and it sends all of these messengers and all this stuff to that site to say, okay, let's build, let's rebuild. And sometimes that gets a little bit out of hand, especially if... Welcome back, everyone, to another episode from the Optimal Body Podcast. I'm Dr. Dom.
I'm DocJen.
And today we're going to be talking about scars, and specifically scar healing, how wounds heal to create scars, why they might sometimes get big and bumpy, and how you might be able to prevent that. All right, so we're going to dive all in on scars and wounds. My professor from college, Dr. McCormick, Heather McCormick, would have been super proud that we're doing this podcast. But before we dive in, if you haven't yet, please think about subscribing and hitting that notification bell so you always get updates on when we come out with new topics. Jen is coming out every week with something on movement or pain issues, and we come out with these podcast topics every week. And also, if you have suggestions for us on what we should go over in these podcast episodes, please comment below because we're always looking for new topics that you're interested in. Okay, let's dive into scars.
So we've been asked about this topic a few times, so we're finally going to dive into scar tissue. What is it? What can you do about it? I think it developed this really bad name, because early on in social media, it was really geared toward using tools to break up scar tissue, whether it was foam roller, scraping, percussion tools, all these things. And so we thought of scar tissue as this horrible thing that's really impeding my movement and causing me pain.
Yeah, and I think clarifying between scar tissue from an actual cut or a wound or a surgery that you develop a scar because you had a cut or you had a really bad traumatic injury versus adhesions where people will get adhesions and I think kind of call it, oh, I've got scar tissue in my fascia or something like that, which similar-ish, or you can develop these adhesions between layers of fascia. And I think that's where you're talking about using foam rollers or using scrapers or percussion tools to blast out the scar tissue in my fascia, when in reality that's actually not real scar tissue unless you've had traumatic injuries internally that have then healed and created all this internal scar tissue. Generally, this comes from some sort of traumatic cut or abrasion or surgery or burn that you then develop scar tissue from.
But let's talk about scar tissue from surgery.
My professor, Dr. Heather McCormick, was obsessed with skin and wounds, and I mean, it's what she did for a living, but it's actually really fascinating how skin heals, and in a healthy individual, it's a very regular process that our body goes through to heal the wound, lay down this initial layer of tissue just to cover the area, and then kind of try and normalize that skin so it can get back to as normal as possible.
But we start with an inflammatory phase, which for about 24 to 48 hours, you don't want to do a whole bunch of movement because we need that blood flow into the area. That's actually really important because that's going to help to prevent infection in those early stages. And when we get all those nutrients to the area, then we go into the proliferation phase where we can start to get early mobilization, early movement happening to kind of help that scar continue to form, which now we're laying down fibroblasts that are laying down the collagen in this parallel manner to help to form this scar.
And that's just I was mentioning, the initial layer. So it's not a very well-organized structure like our skin is. It's basically just to cover things up to prevent infection, to prevent any more blood loss, to get this all under wraps so then our body can start to figure out, okay, how do we really create a stronger layer of skin here? And that's when we get more into this modeling and maturation phase of the skin. And based on how deep a cut or a burn or whatever it is, an abrasion goes into those layers of dermis, this process that we just outlined could take anywhere from 6 to 8 days to 6 to 8 months or longer.
If you go see even a physical therapist, especially if you just had surgery, you're seeing a physical therapist usually in the hospital, they're going to go through some of these processes with you because this is starting to take care of the wound. This is how we start to take care of that scar tissue that's forming, and to make sure that we're forming tissue that's not only protective within our system, but still mobilized within our system. And I think that's what, especially coming from burns or anything like that, that's what a lot of people have issues with.
A lot of what people want to do is avoid these hypertrophic or keloid scars, which are, either scars that have started to get a lot wider and it just develops kind of a lot of a weaker area of skin, and it might be unsightly and people just don't want to have that big of a scar, or these keloid scars that just like get really big and bumpy, and it's actually just a development of a lot of extra tissue. And during these initial phases of when our body's creating scars during the inflammatory and proliferation phase, our body, again, we said like it's amazing. It has this process built in and it sends all of these messengers and all this stuff to that site to say, okay, let's build, let's rebuild. And sometimes that gets a little bit out of hand, especially if we have repeat irritation of the area. If the scar or the cut is on a joint like the knee and we're needing to bend it and it's rubbing on different clothes or rubbing on bandages, that's just going to keep us in this prolonged inflammatory phase.
But knowing that as we get later into the phases of healing, that we do need load to help rebuild that scar and create more of that mobility and strength, so that we don't only have that protection, but we have that freedom of movement and it's a little bit stronger.
I mean, our fibroblasts, which are the things that are laying down the collagen, and the collagen itself responds to that stretch and it responds to that mechanical load. So that's where through all stages of incision healing and scar healing, to be able to move our body in kind of the natural way, again, as long as it's not impeding the scar healing process or the incision healing process to any point, or adding significant extra irritation, which might keep us in that prolonged inflammatory phase. We need to have that natural movement to educate those fibroblasts and that collagen, like how it should be healing to form the strongest layer of skin possible.
So let's discuss some of those techniques that we mentioned that can help with some scar tissue formation, so that we're rebuilding in that stage and that way that we really want to.
Yeah, one that you'll see on a lot of different wounds or incisions, especially coming out of the hospital, but something that can be beneficial is having compression over that incision. Because again, we do want inflammation, but compression is something that can just help to mute a little bit of that, what might become prolonged inflammation.
Especially after that first day to day and a half, like we don't want to continue that phase of really having so much blood flow coming to that area.
Yeah, so a lot of times you'll get this like neoprene type compression sock or compression stocking that you can bring home with you and have over the area. That just will help prevent too much blood flow to the area and too much inflammation from proliferating.
Another technique that people will use is just mobilizing the scar tissue, which is a huge one. And this is something, especially if you go in person, which hopefully if you've had surgery or a major accident, you're going to see a physical therapist in person, right? And they're teaching you techniques or either doing techniques on you to help mobilize that scar tissue around the area.
I think every PT, if there's any PTs out there that would be listening, of, or anybody who's listening who's had a total knee or total hip replacement, you've probably seen your PT work on your scar where they just kind of work it side to side. And again, this is really once we're well into that maturation phase, generally when we're working in the clinic, and you work on the scar side to side and you just start kind of working that skin, especially the healing scar, in all directions. Because again, we're starting to give that stimulus where, hey, we need this skin to be able to move in all directions. Because most scars, if you've ever had a scar on yourself, you'll notice that they feel sticky.
Yeah.
Like if you try grabbing that skin and lifting it up, there's a portion that is kind of sticky to the tissue underneath it. So just getting that moving side to side, back and forth, doing circles, working the directions of the clock can be great on that scar tissue.
We're going to help by controlling like kind of the direction and the length of that scar by being able to do those mobilizations. We're also helping to, kind of relax that contractile element of the scar, so it's not feeling the need to be so sticky.
A little bit more advanced injuries, like there was a resource that talked about silicone and how silicone can be used within the first month or two to be able to kind of help reform that protective barrier and keep the skin hydrated. And I think that this was talking more specifically with a little more severe burn injuries, where people might have large areas of their skin, because then you lose the ability to sweat when you're developing scars. You don't have, sweat glands on that tissue. So you need to keep that skin hydrated. And you also lose the ability to have that temperature regulation because of that. So
it's just like a topical treatment that you can use.
Yeah.
But that would most likely be,
with a professional, with somebody who's like a wound care specialist in a hospital. This isn't like,
go get silicone topical treatment for yourself, This is something that is early on. And if it does end up happening to you, you do end up with a burn, something you can ask your clinical provider.
Yeah, because there's all sorts of other topical options, and I'm sure that there's some silicone-based options that you can get over the counter or from a doctor, but then there's also different steroid topical treatments that you can use. Again, steroid medications will tend to attack the inflammatory process, So if you're starting to have some longer term inflammation, this is a topical treatment that can start to just kind of knock that down. Again, would be something you'd probably get from your doctor.
I mean, they did talk about some corticosteroids that really help to reduce, that collagen formation.
They also mentioned how it was great in the short term.
It was great in the short term for sure. And it really could help to reduce that risk of getting that keloid scar. So that's kind of like that thicker scar that we talked about in the beginning.
There were some brief things that mentioned laser or cryotherapies. And I think both of these kind of what they mentioned, like with laser therapy, it said it essentially kills some of the surface level micro veins and micro capillaries that, again, are just delivering a lot of this blood flow, or it might be used to target inflammation. So a lot of these therapies, I think, are more so just we can use this to target some of that prolonged inflammation you might get in an injury process like this. Same with cryotherapy treatments. There were some talking about how they would use liquid nitrogen to stop blood flow to a scar area, or just even topical, local methods of using ice packs and stuff like that. I'm sure would help bring down blood flow and maybe start bringing down any of that prolonged inflammation.
One that was cool, like if you've had a cesarean, so a C-section, just applying simple tape can help, I think it said within the first 12 weeks to kind of help reduce that chance of a hypertrophic scar to form. And
I think that points out something cool about just if you have a wound dressed properly.
Yeah.
It's probably giving a little bit of that pressure. One of the first things that we brought up, a little bit of that pressure onto the wound and preventing anything from kind of getting out of hand.
I mean, I think overall, understanding that early mobilization for scars is pretty good, right? We want at least a day or two to kind of relax, allow the body to do its thing, but then starting to get some mobilization around. You can even use your fingers. You can start to desensitize a scar. That's really important too. So if you're using like a towel, so say I'm on my stomach, because say you had a C-section, right? Or any scar anywhere, but you're using like a towel to just lightly kind of brush over it. There's a lot of sensitivity to that area. So before we start really like tugging and moving, just starting to desensitize the area of the scar is really important, and light touch is something that's really crucial that we do in the clinic as well. So just starting to get some light touch in the area, making that a little bit less sensitive, and then we can start to go on to, exercises where we're starting to move the tissue. And then beyond just moving the tissue, that's when we start to move our bodies, because moving our body helps to, again, mobilize that area to help with that rebuilding and that remodeling. Even if we start moving in different areas, moving and mobilizing our bodies, that's going to help and play a role on what we're feeling in other areas. And so you don't have to be stuck in, I just have scar tissue. This is what I've been told. I have these adhesions that will never go away. Well, that doesn't mean that you can't improve the mobility and improve the strength around that area so that you improve the function. Everything is about function. It's not necessarily about the structure. So if you're improving your function, then you're reducing those pain signals and you're just starting to feel something different. Thanks so much for joining us. I hope that helped to clarify a little bit more on scars. Really, it helps to work with someone in person and make sure that you're asking for those people, right? Who can I work with? Who can help me with this scar? And if you feel like you still have stuck scar tissue, check out jen.health. Free trial. We have it below, linked up, so that you can always continue to move your body and feel your best.